morning, dear students. Today we are going to learn which are the diseases that is caused because of the deficiency of vitamin D. We all know that there are two diseases. They are rickets and osteomalacia. The deficiency diseases because of vitamin D, low level of vitamin D are rickets that is happening in children and osteomalacia in adults. So, as the low level of vitamin D is causing rickets, this vitamin D is otherwise called anti-rachitic vitamin. So, that is its another name. Okay, next we are going to see how the deficiency of vitamin D is happening. In those people who are not properly exposed to sunlight, they have the chance to develop low vitamin D in their body. And this situation is common in inhabitants of northern latitudes during in their winter months, especially in the winter months. And also in those people who were bedridden for long periods, in those persons, there's no chance for them to get exposed to the proper sunlight. So we know that for them also there is chance to have that situation. And also those persons who be almost wearing a parda by covering their whole body, those persons also have a chance to have this low vitamin D or the deficiency of this vitamin D. And next situation is that malabsorption of vitamin D. A proper absorption of vitamin D is not happening in our body. Then that also may lead to the deficiency of vitamin D. Can you suggest one instance how it can possible if we have a diet that is rich in folate? What do you mean by this folate? Folate means it is an acid, it is otherwise called a phytic acid. What is it? It is the principal storage form of phosphorus in plant tissues. Where? In plant tissues. In which all plant tissues this phytic acid is storing, especially in bran and seeds. And as we include such type of food in our diet, and this phytic acid may reach in our body, and they are forming complexes with the metals or proteins available in our body and affects its proper absorption from the gastrointestinal tract. So in that way, we could understand that this phytic acid are anti-nutrient compound. It is affecting the proper absorption of metals and proteins from the gastrointestinal tract. So what you understand from this statement? The food that is that contain more phytic acid is not at all good. It is an anti-nutrient compound. Okay. And so that also can lead to the deficiency of vitamin D. Next, uh, abnormality in the activation of vitamin D. Activation of vitamin D. Do you have a memory about that term? Where that process? What is the significance of that process activation? We learned that vitamin D is synthesized in an inactive form called calciferol, and later it is activated to its active form calcitriol through many steps of hydroxylation that is happening in liver and kidney. So, if the liver or the kidney is suffering some disease or some defects or something that is not normal, then that will retard. That will affect the hydroxylation reaction of vitamin D. By that way, it will not convert to the active form calcitriol. If the active form calcitriol is there, then it will certainly bring about so many other deleterious effects in our body. Okay. So then next we are going to see what are the symptoms, what are the features of this diseases that is caused because of vitamin D deficiency. Especially we learned that this vitamin D is very important for the mineralization of bone by indirectly by helping the absorption of calcium and helping its deposition in bone to bring about its mineralization, so that in that way vitamin D is necessary. If that vitamin D is less, its level is low, then by that way bonds become soft and pliable. Clinical manifestations include bow bend legs. Then knock knee is this type of appearance. Knee are locked. Then rickety rosary means what? Rickety rosary, I'll show you that condition. Um, this our rib cage, it have some beaded like appearance. Bead like appearance, that's like a chanting chain. And that's just like the beads in a chanting chain. So that type of appearance will occur for the rib cage. So that is the condition. A row of bead-like prominence at the junction of rib and the cartilage. Okay. Bossing of frontal bones. Bossing of frontal bones means the frontal bones become more prominent in this way. So that is the condition. And pigeon's test. That's a condition is having a pigeon's head-like appearance for the chest cage because of the overgrowth of cartilage between the ribs and the sternum. Between the ribs and the between the ribs and the sternum, the cartilage grow abnormally, and that gives a pigeon's head-like appearance. So that is abnormality, and this is a photo of the same patient that is cured of out of that condition. So that is what. So these are the clinical features of rickets, and also one more thing, Harrison sulcus. Harrison sulcus means an intonation. Intonation is happening most commonly to the sixth rib, I think. A transverse depression is passing outwards from the costal cartilage towards the axilla. From the costal cartilage towards the axilla, depression is happening, an intonation of the lower ribs at the site of attachment of the diaphragm. So that condition is called Harrison sulcus. So that is also a feature of rickets. Then clinical feature of osteomalacia. Osteomalacia, a case that is occurring in adults because of vitamin D deficiency. Here also the bones are softening due to insufficient mineralization. How it happens, I already told you that. As vitamin D reduce, it affects calcium absorption absorption, and this will in turn affect the mineralization, the building up of bone, mineralization of bone. By that way the bone become soft. Bone will become soft. So that is one situation that happens out of this vitamin D deficiency in the condition of osteomalacia. And also osteoporosis, that softening of the bone may lead to osteoporosis, and because of that that defect, that person may prone to, they are subjected to fractures very easily. Then, and also as we check the serum of those patients, they have only low level of calcium and the low level of phosphate because it is not properly get absorbed from the diet across the gastrointestinal tract to reach the serum. So that is why its level is low in the serum. And also serum alkaline phosphatase. Alkaline phosphatase means is the enzyme that is helping for the mineralization. So as the bone is weak, then alkaline phosphatase amount, serum alkaline phosphatase amount will be high to increase the mineralization of the bone. So that also is a sign that the calcium level and phosphate level is low, and which in turn indicates that vitamin D level also is low there. Then which are the types of rickets? Hypophosphatemic rickets. Hypophosphatemic rickets. How it happens? It happens mainly because of the defective renal tubular reabsorption of phosphate. So look, reabsorption of phosphate is not properly taking place. That means it is excreting out from our body. So it is excreting, body is losing. So that's why that indicates the level of phosphate in the body will be low. And how we can correct that situation by supplementing vitamin D, and also along with the levels additional amount of phosphate. That is that can rectify the situation. And also next type is vitamin D resistant rickets. And this type of disease, this type of ricket is found associated with a syndrome called Fanconi syndrome. It's called a Fanconi syndrome. What's happening there? There also the renal tubular reabsorption of this bicarbonate, phosphate, glucose, and amino acids is not taking place properly. So that may lead to this vitamin D resistant rickets. Even though vitamin D is present there, then also its reabsorption is properly taking place. And that is leading to a syndrome. It's called Fanconi syndrome. Renal rickets. Renal rickets means in the case of kidney diseases, even if the vitamin D is available, the calcitriol is not synthesized. That means the vitamin D is not properly activated through hydroxylation. We have learned that the final step of hydroxylation is happening in the kidney, and as the kidney is in defective, then that proper activation is not happening. By that way, calcitriol is not synthesized, and as there is no sufficient amount of calcitriol, then calcium absorption, all those things will not properly happen. And in those situations, we can treat the patients by administrating calcitriol in the form of some medications or like that. And the last case is end organ refractoriness. Refractoriness means unmanageable condition. That's the meaning of that word. End organ refractoriness to what? 1 to 25 DHCC. It is an other than this calcitriol itself. And that also cause a type of rickets. What's happening in that case? We have learned in our former video that across whichever cell the calcium need to be transported, it needs energy, and in such cases the calcitriol being acts as a hormone, it enters the cell and binds with a receptor that is present inside the cell. And in those persons having this effect, this receptors number of these receptors will be low, or sometimes it is defective. Then the further further process will not be happening in that cell, and that will in turn affects the proper absorption of calcium. In such persons, that condition can be treated by administrating the mega doses of calcitriol. That's about 35 milligram per day of that much amount calcitriol need to administrate to that type of patients. The patients, people, those are having that type of disease. Disease need to give this much amount of calcitriol. So that's all about the deficiency of vitamin D, which are the diseases, what are its features, all those things. I hope you understood every point so clearly. So thank you. Next, we are going to understand about the requirement. What is the normal amount of vitamin D that we need for our body? In the case of children, it is 10 microgram or 400 international unit per day. In the case of adult, it is 5 microgram, that is 200 international unit per day. In the case of woman, pregnant woman, or lactating woman, the amount is slightly higher, that is 10 microgram, like that in the case of children. And above the age of 60, those persons require 600 international unit. That is all about 15 microgram per day. This amount is high when compared to all the other levels. That means as we cross this age, we need to get proper exposure to sunlight to develop vitamin D in our skin, in our body. Then, which are the sources of vitamin D? Surely, exposure of sunlight is the ultimate source of this vitamin D, or called calciferol, and also from other external sources like fish liver oil, fish egg yolk. They are all good sources of vitamin. Milk also contains moderate quantity of vitamin. Then hypervitaminosis of this D. That means when in our body the level of vitamin D is high, then what will happen? That condition is called the hypervitaminosis D. And what is the level? If the dose is above 1500 units per day for a long period, that is toxic. And in such persons, they develop symptoms like weakness, polyuria. Sorry, polyuria means it's a condition in which that person develop an intense feeling for having frequent urination. Means often don't that person feel to go and pee. So that is polyuria. Frequent maturation. Okay. Then intense thirst, difficulty in speaking, hypertension, weight loss, all these are symptoms. And hypercalcemia, calcium level also may increase in connection with the high level of vitamin D, and that may lead to calcification of soft tissues. That condition is called metastatic calcification, otherwise called calcinosis. And especially this type of development is happening in vascular blood vessels and renal tissue. That's also not desirable. And all this statement doesn't mean that as we expose our body enormously or excessive exposure, it will not result in vitamin D toxicity. Why? Because the excess vitamin D3 that is forming in our body because of the excessive exposure to sunlight is destroyed by that sun's rays itself. So that doesn't happen. So don't nobody please don't think that if I expose to sun too much, then the vitamin D level in our body may steepen and that may lead to any toxicity. It will not happen because sunlight itself uh, destroy the excess vitamin D3. So by that way, we are going to stop today's section. Thank you.
I'm an icon, man. Name a girl about a 10. I should fuck her in a Benz.